What is oncology?
This is indeed a very pessimistic way of dealing with this specialty. But of course, it's not something that is admired by anyone to hear this word. But oncology is an area of medical field dealing with usually cancer patients. Okay, but we know that not each cancer is the same, and there are diverse disease types, and each disease is specific to that patient. So it is important to understand what type of tumor it is, and it's just above this histological classifications these days. You know, there are many different tools to understand the type and the behavior of this disease, because it changes from person to person. So when you say lung cancer, it doesn't mean that it's just one entity. It's just resembling an entity that is encompassing a different spectrum of tumor cells that are treated in different ways. So we should always be more realistic, of course, but not that much pessimistic when we hear the word cancer. You are not only an oncologist, we are also kind of psychologists while dealing with a patient. And indeed, what we call this relationship is an engagement with the patient. We say that, okay, we are engaged, maybe we are married, it's not clear yet, but we are going to be walking this way to the end of whatever it is. Mm-hmm. So it's a big journey, and during that time you are not only the doctor, but sometimes maybe the friend, but sometimes you're the one who is really caring about that patient. And I think it's most important part, because when the patient feels that honesty and has the trust to you, then I think the treatment really become more effective.
So for the patient, you are confident.
Well, yes, in my part, yes, of course. And I want the patient to be confident with me too, to trust me and to trust the way that I'm dealing with her, that I'm doing my best to help them.
What is important to treat cancer? How to treat cancer correctly? Surgery, radiotherapy, or chemotherapy?
Well, the answer to this question is none as a single part, but yes, totally. It is a teamwork indeed. It is, oncology patient is a kind of patient who must be dealt with many different specialties. So this is a team job, and most of the time, every oncology patient is dealt in a multidisciplinary setting. This multidisciplinary setting includes medical oncologists, radiation oncologists, the specialized surgeon, pathologists, radiologists, nuclear medicine doctors, psychiatrists, dietitian, and genetics, and many specialties are included in the management of an oncology patient if you are trying to do your job in the ideal way, of course.
Doctors say that 40% of death from cancers, tumors, are preventable. At what age we start to make screening?
Well, indeed, these are different issues. Preventable means that when you change something, then you can end up with some different results. And this usually starts from your lifestyle, which includes the food that you eat and the smoking and alcohol, and the way that you are dealing with the life, especially the stress and doing exercise, having a more active life. There are different ways of decreasing your lifetime risk of having a cancer. And this is something not a magical formula indeed. So you may see in the social media there are different remedies for preventing cancer, but indeed it is something very simple. If you consume less sugar, if you consume less processed meat, if you consume diet higher fiber including diet, and if you avoid smoking and alcohol, then you will probably be preventing most of the cancers that are related with these bad habits and bad way of living. And especially exercise is an important issue that should be emphasized deeply. You know, these days, everything, every development in the modern life makes the people more lazy, yes. And we are more reluctant to move, to walk, and to do our jobs ourselves. So this way of life, of course, it affects ourselves in a worse way, so that we are really having higher risk of having insulin resistance, and this insulin resistance may promote some tumor cells to grow. And so there are, of course, these are not just directly causing maybe cancer, but we know that indeed all cancers are due to some genetic disorders. That doesn't mean that it is inherited, but this bad habits in your life and bad lifestyle causes some genetic changes which end up with cancer. That's why, yes, 40% are preventable, but screening is something different. So you can just detect some cancers in an earlier period, and these are already in the timeline of screening and preventable cancers. And these are colon cancers, so you have to start colonoscopy. Usually it was recommended to be started at age of 50, but these days we have the data that the younger colorectal cancer patients are increasing. So in most of the guidelines now, it is the threshold for starting colonoscopy is 45, for example. And
for men?
Yeah. And of course, if you have someone in your family, especially the first-degree relatives with a history of colorectal cancer, maybe you should start earlier. There are some syndromes that cause that will increase your risk of having this colorectal cancer, such as familial adenomatosis polyposis, that is described with many different, more than 100 polyps in your colon, and these patients even should start screening at the age of 20, for example. So one is colorectal cancer, the other one is cervical cancer for women, and it should start when the active sexual lifestyles start. And prostate cancer screening is an important issue also. For men, especially above 60, you have to start PSA screening and this physical examination. And another issue is that since this tobacco and smoking habits have been really increasing during the last decades, we know that screening high-risk patients who have a history of smoking for long years is also being recommended with low-dose computed tomography these days, and we know that this will also decrease the frequency of lung cancer patients by detecting them in an earlier period, of course.
How important is the diagnostic?
Of course, this is a major problem in many countries, especially in developing countries. But you know, even in developed countries, we know that there is always some delay for patients to go and to reach a doctor that is going to be solving that problem. Sometimes it takes a long time to have an appointment for a computed tomography. Sometimes it takes 1 month to have a result of a pathology tissue. So I guess, especially in our institute, we are able to do all of these facilities, both in the period of diagnosis and starting the treatment. It is, we are trying to do it as fast as possible. Mm-hmm. And that is possible when you are working with people who you can contact easily and who are dedicated to their jobs, and so that the people will be diagnosed in an earlier period. Of course, it is important for the patient to understand their symptoms and to go to the doctor without postponing their complaints. It is also a very important issue. But even when the patient realizes these symptoms, sometimes due to these delays in having these health facilities, these diagnostic procedures are even delayed for 6 months and more, and the patient starts maybe in an earlier period but ends up with a metastatic state. So it's really an important issue.
How important is the technology in your job?
I should never omit the person factor, but technology is important. Yes, to have a true diagnosis, you need a specialized pathologist, you need a specialized radiologist. So we have different doctors who are dealing with different areas of these main facilities. I mean, we have an interventional radiologist, okay, a radiologist who deals with mainly lung tumors, another one dealing with the gastrointestinal disorders, and this is also valid for the pathological evaluation. So it is important to have the good tool, but it's important to have the specialized person who is going to just finalize the diagnosis.
What can you tell us about modern cancer immunotherapy in the treatment of solid cancer in adult patients?
Yeah. I guess during the last decade, immunotherapy has been an important key in the treatment of many solid tumors. You know, the development in oncological treatment perspective starts in the advanced stage. And then when you see that the drug is effective, then it is used in the earlier periods. The story with the immunotherapy started like this. The idea is that you have an army which can just fight with those enemies, but they are reluctant or lazy to go and to fight with these tumor cells. Because the tumor cells are clever and they tell the armies that, okay, we are one of you, we are not foreigners. The immunotherapy idea is taking away the brake over these the soldiers, and induces our own army, so this is the white blood cells or the lymphocytes, to attack or to fight with these enemies, that means tumor cells. So your immune system becomes activated and recognizes the enemy and fights against it. Of course, this is sometimes ending up with some side effects due to this natural overactivity. Sometimes these immune system may recognize your own cells as an enemy, and there might be some side effects due to this. But we know that immunotherapy has really made a huge, remarkable development in the management of cancer patients. Even some stage 4 advanced stage patients are cured totally with immunotherapy. And there is a specific group of patients within all these oncology patients who get a huge benefit from immunotherapies. Of course, it doesn't mean that it's again a magical drug that is useful for every patient, but we know that this subgroup, we can identify those group of patients, and we have some biomarkers to detect which patient would get the most benefit from immunotherapy. But the efficacy of immunotherapy is not limited to only these patients. By adding some other different tools to this immunotherapy, such as chemotherapy, sometimes radiotherapy, some targeted therapies, you can still increase the efficacy of these drugs and get effective for the rest of the patients also. So I think we are going to be using this immunotherapy more commonly in the next years to deal and to treat our patients.
And what about the transition between chemical and biotechnology?
Well, still, if you are trying to say that chemotherapy by chemicals, yes, it's still an important part of treatment of many tumors. But now, as I told, immunotherapy, targeted therapies, and precision medicine, I mean, in the context of targeted therapy, is an important information that we need for the treatment of many, especially advanced cancer patients. Because by using those techniques, precision medicine, cancer genomics tests, we call them as next generation sequencing techniques, when you can screen many genes together at the same time and get the comprehensive information about that patient's tumor type, you can just personalize your treatment according to that result. Of course, this is not just only one thing that is necessary to to make the patient's treatment, but it provides important information to understand the resistance mechanisms and the efficacy of the drug when you have such a report regarding that patient's specific tumor.
According to the 2020 World Cancer Statistics, approximately 20 million new cancer cases are seen annually, and 10 million people die every year due to cancer.
Yeah. Screening methods, when they become more available and easy and accessible and cheap for every person, I think the success rate of treating cancer patients will be increasing enormously. Because the important thing is to detect that tumor when it has not spread to all over the body. Still, you may have some solutions even at that stage, but it's important to identify at the earlier period. Now, there are different tests being developed where just you can detect the tumor cell even from the blood or from urine or from oral swabs. And probably we are going to be using these tests more commonly. For example, I did not count ovarian cancer as a cancer that is screened or a pancreas cancer because it is not currently easily detectable with the available conventional radiological techniques, and screening is not useful with the current tools. But when we have such tests that are ready to detect these tumor cells before they become advanced, probably our success in treatment of these cancer patients is going to be higher. Well, one of the Romanian patients it was indeed when I started working in this hospital, I guess it was 7 or 8 years ago. He's a well-known guy. Well, he came with a very advanced stage testis tumor. And he was really very bad, and we had to start the treatment emergently. And fortunately, this tumor, it's not my success. I mean, testis tumor is a type of cancer which is sensitive to chemotherapy. But we really acted very fastly, and we did the most effective treatment to him, and we even made stem cell transplantation with high-dose chemotherapy, double, and his tumor was completely resolved. And last week he sent me the photos of his son.
Oh!
Yeah, it was really a pleasure for me. And when you asked this question, he was the first one that I remember.